So I'm back here in the London studio, as I'm calling this little alcove here beside John Keats, a poet, apothecary, surgeon from Guy's Hospital, to do a very special episode with friend of the podcast, ex-Melbourne fellow, my friend Veeru Kasi. Veeru, how are you?
Hi Declan, I'm doing great. The sun is out and life is good.
Is it nice to be back on GUcast? You've been on before when you were doing your fellowship with us in Australia.
Of course, I think this might make it a hat trick. It's a great to be back, and of course also celebrate your 5-year anniversary. Time has flown so quickly.
Yeah, well look, thank you for coming to our 5th birthday here in London this week, and for bringing some of your team, who we'll get to in a moment. So we've decided to dedicate this episode to talking a bit about some of the research initiatives that Veeru's very early career so far has been characterized by. Because, you know, for our audience, Veeru, it's a mixed audience of people who are working or training in GU oncology, so medical, nursing, other allied health trainees, also patients and also industry. But for this one, we want to focus a bit on younger people coming into GU oncology, predominantly clinical type training, but maybe young in industry as well, to talk about that. And there's a particular initiative called Compass that we want to ask you to introduce your team and explain what that is, and then we'll dive a bit into what it's up to and what sort of projects, and we'll talk a bit about EAU Congress recently and highlights from that. But maybe we should meet the team first.
Sounds good.
Yeah, so who are you?
Thank you, Declan. Alex, I'm a PhD student working with Veeru in the Compass team, currently working on a trial development for my PhD.
So you're a medical graduate and doing a PhD with Veeru?
Yes, so I've been working with Veeru for the last 5 years, graduated from UCL as well, so delighted to be working at UCL still.
I feel like I know him, because actually I know who Alex is, because I've been meeting him since he was a student, hanging around with you and your group and attending meetings. Hello, who are you?
Hello, firstly, thank you so much for the invite. My name is Aishwarya, and I'm currently a 5th-year medical student at UCL, and I've also joined the team with Alex, Veeru, and everyone else, and very excited to be here.
Love it. So Veeru gets them early, Alex, doesn't he? He grabs enthusiastic-looking medical students and, you know, opens pathways to doing meaningful research. So hopefully that's you, Aishwarya. Who's next?
And Alex?
Another Alex.
Hi Declan, thank you for having me. I'm Alex, a 3rd-year medical student and bioengineer. I was recruited for the Paradigm trial team last year, and I'm very excited to be here.
Great. All right, Veeru, there you have. So you brought out a few talented young prodigies of yours. And tell us a bit about this Compass thing first. I remember BURST. BURST is now a well-established thing all around the world. We know what BURST is. It was a group that you put together, young urology trainees in the UK. Some amazing initiatives came out of it, RESECT and so on. So maybe a bit about BURST, but what's Compass?
Yeah, so Compass stands for the Centre for Urology Imaging, AI, Prostate and Surgical Studies, and it focuses on the type of work that we've got experience and have delivered over the last 10 years.
Really good.
It stems slightly from BURST. We do collaborate with BURST on a number of projects. The idea behind BURST is that it's a trainee-led organisation, and it delivers multi-centre projects across the world which can change practice. Our focus, our bread and butter, is primarily urological cancer research and prostate, because everyone loves the prostate, but we do branch out into other things, hence our name.
Yeah, and what's the idea behind getting medical students involved, as well as young trainees and postdocs?
Yeah, well, I find I learn the most from when I have other people around me, and I find they have ideas and energy, and I find I myself improve the most when I involve them. And I personally find it satisfying to see them grow, see them achieve amazing things, as many of my team have gone on to do. And that's one of the things that drives me to do this in the first place.
Totally agree with you. And you know, when I was a medical student all those many years ago in the west of Ireland, I did have a chance over a holiday period to get involved in a breast cancer research project, just a small, simple thing. I think there was a small grant of a few euro to support it for a few months during the summer holidays. And it ended up being an incredibly powerful period for me to focus my mind and my ambition on why research is important, as me as a medical student with no idea, you know, what I wanted to do. So I believe that creating a structure or an environment that talented young medical students can work within is a really, really worthy thing. Yeah. So we want to talk a bit about current projects in a moment, but first of all this gang were at the European meeting, the EAU meeting in Madrid recently. We met some of you over there. So, you know, medical students going to the EAU, stuff like that, is that normal?
Wasn't normal in my day, Declan.
No, mine neither.
You know, maybe we can ask them why they came and what they gained from it.
Good idea. Over to your Alex first.
Thanks, Veeru. I think what's truly attractive about these huge international conferences is the sort of sense of collaboration and community that you find. You know, everyone's communicating about the research they're doing, and that's really what pioneers innovation in such a dynamic field that urology is. So, you know, you get exposure to your robotics, to your diagnostics, to your intervention, and I think it's absolutely wonderful to be involved and learn. It's all about learning, and I think that's what these conferences truly facilitate.
Was this your first time attending a meeting of that size, a big international meeting?
It was actually my first ever international conference.
And you, Aishwarya, were you there? So, I mean,
Yes.
it's quite an inspiring place to be, you know, to be at this big meeting with these huge screens and these really impactful speeches. Did you find it an inspiring and exciting event to be at?
Absolutely. I mean, of course. I think for me to be able to answer this question, I'll have to go back a bit. So you start off applying to medical school thinking, well, why am I joining? I really do want to make a difference, cliche answer as it is. But how do you actually go about doing that? Well, at medical school, you don't really get to do that very much, normally. I mean, the core curriculum is focused on the medical side of things. Research, you may do a bit of it if you have the opportunity to intercalate, if even that. But what about the things that are actually changing clinical practice? Well, that's clinical trials, isn't it? And the people who are at the cutting edge of this sort of thing, they're at EAU.
Yeah.
And to be even just exposed to that level of, for example, knowledge, and seeing that sort of collaboration is so, so inspiring. Because if you don't see it, then how are you going to be part of it one day? And for us to have had the opportunity, thank you so much to the Compass team, we're actually so inspired and honestly still buzzing, even though we've been back for quite a while. But no, memory's still fresh in my head.
Veeru, I remember the first EAU I would have attended, it was when I was like a research registrar, you know, kind of almost at this Alex's level, bit older. And I was, just like you said, Aishwarya, I had similar sort of experiences. So I can't imagine what it's like being that much younger. Now, I'll take you back to when you presented in the practice-changing plenary at the EAU in 2018, when you presented the precision trial. And you were like a first or second year trainee, or had taken time out for PhD. Where was that meeting? Like Copenhagen, was it?
Copenhagen.
Yeah.
I'll never forget.
Exactly. So that's what he did, guys. You know, a few years ago, stood up and nobody knew who he was. Those of us who knew him knew who he was, but like auditorium, many thousands of people. Who's this youngster standing up presenting a paper in the New England Journal of Medicine that changed the way we all practice nowadays? That's the glittering prize, I suppose. On the one hand, do you want to tell us a bit about that? Because what I want to ask you about is, what about the other end of the EAU, which is even more important in many respects for your level, the poster sessions, the abstract sessions, where you know, smaller rooms, you know, more preliminary work, not the final big trial. But yeah, tell us. Remember back to Copenhagen. I remember that very well because I was there. I was the discussant on your trial.
Yeah, it's convenient, eh?
Yeah.
So look, it's exactly the same as they're describing, and it wasn't so long ago that you remember it was the first EAU that you went to, and I remember the experience and the feeling of there being so many exciting things going on, but it was quite daunting. You were there was this big conference, that EAU classical music that you hear that played at the opening ceremony. I remember that, and it's the same music that is played now, but it does give lots of emotions when you hear it, because I started presenting a conference and a poster as well, and I was really nervous about it. It was the most important thing to me, but that's where I started, and you've got to start there and build your way up. And then over time, when you see all these amazing, inspiring people and you get involved in the work they do, you can see what can be achieved and how you can change practice. And I think that's the thing that kept me going through those years.
Okay, so Alex, the other Alex, for those who are not watching on YouTube, we have two Alexes. The Alex beside me is the one who's doing the PhD, but I remember meeting you at the EAU a few years ago when you were a medical student, you and Aqua and a couple of others. And so you've been to this, you were there this year, so this is probably your second or fifth EAU. Oh my God, you know. And so what's your take on it then? You've been almost through this program that the other Alex and Aishwarya are on, so you're like a mature attendee of an EAU meeting now. You know, and now you've done quite a lot of research, and so you're beginning to see, okay, where, you know, what the output, how meaningful it can be, and the ideas you regenerate from presenting your work at a meeting like this. So yeah, what's your experience now?
Yeah, definitely. EAU is always a great meeting. Good to see our international collaborators and see the real cutting edge of research, and it really helps to drive your thinking process to developing the next trial. And it's been really good to, 5 years later, be on the other side of it, so kind of halfway through Veeru and the students here. So being part of a trial, the prime trial, which is now under review, having been part of that and leading it for quite a number of years, and then to use that knowledge, skills we've developed to then develop my own ideas for the PhD as well is really good. But it's also really worthwhile to see the development and growth of our new team members as well. I really remember 5 years ago when I was at their stage, attending for the first time, everything's quite daunting, everything's very big, so it really helps to mentor them as well as to what's best to get out of it. Hopefully in 5 years' time they'll be where I'm at, and maybe in 10 years' time I'll be where Veeru's at. So it's really growing the cycle, developing the team. I think it's also good to see how EAU is developing. So, big trials get published, and the gold standard is really to aim for that co-publication, co-presentation. But I think at EAU it's slowly changing. There's now a third tier, I'd like to say, which is also to have your co-GU cast on the big papers, as we've seen this year as well.
We love it, yeah. Thank you for that. You get a free hat or something. Okay. We like to try and sell that to trialists to say you want the EAU plenary or ASCO GU, you want the co-publication, and you need the simultaneous podcast to drop. So that's what we do here at GUcast. So we've heard a bit. I love this, the inspirational environment that's set up, and this Compass group sounds really like that. But we want to now, Veeru, hear from you and your group about ongoing projects and stuff like that. Actually, maybe you'll just do a quick mention of PRIME, the PRIME trial, but then dive into current work with Compass. Over to you, co-host on this episode of GUcast.
Yeah, so maybe we can start talking about PRIME a little bit and about what the project was about and what the implications are. So Alex, do you want to maybe tell us a bit about PRIME and what the summary of the findings are and what it means for people?
Sure. So PRIME is an international level 1 prospective trial looking at biparametric MRI, so MRI without contrast, and comparing that to the current standard of care, which is multiparametric MRI with contrast. So we know that since lots of level 1 evidence trials have come out, international recommendations have changed, recommending pre-biopsy MRI and MRI targeted biopsies in the detection of cancer. But we know that resource limitations mean that men around the world aren't necessarily receiving an MRI at all, or even one in a timely fashion. So these resource limitations are really prohibiting the global adoption of prostate MRI. So the PRIME trial was set up with the team led by Veeru about 5 to 6 years ago. And essentially we recruited just under 500 men from 22 centres around the world. And a summary of the key findings are that we've identified that biparametric MRI is non-inferior to multiparametric MRI in the detection of significant prostate cancer, and also does not lead to an increase in the number of insignificant cancers being detected. And most importantly, I think a very important finding is a concern that less MRI information may lead to more biopsy recommendations. But in fact, we did not find this in the trial, and I think that's a really important finding.
And that's going to be in a popular magazine sometime soon, I suppose.
Hopefully. Watch this space.
Yeah, so the data's been presented, and great. This is another skill they need to get, Veeru, snappy presentations now. I'm sure these youngsters are like that. They're used to short-form communication styles, but that was a great summary of a huge effort. But and we look forward to seeing that one in a glossy magazine sometime soon. Over to you. What else?
Yeah, so maybe we can talk about a new upcoming project, which is really exciting, called Paradigm. Maybe I'll introduce it, and you guys can maybe tell us a bit more about it. So we want to focus on areas which we think have unmet need, and PRIME focused on getting MRI out to as many people as possible. One of the next major limitations with MRI is being able to produce a high-quality report, and any man, anywhere, no matter what hospital they're in, having access to a high-quality read. So maybe Alex can tell us a bit about Paradigm and how that might address that.
Thank you, Veeru. I think it's a very timely, opportunity for conducting a study like this, where we're comparing radiologists to AI for the detection of prostate cancer from MRI. As Veeru said, there are many global challenges and barriers for men accessing, and of course intra-observer variability. So to ensure that all men can have access to the same care and have the same positive outcomes, I think it's a super important area of interest, and it's always changing as well, so it's important that we get on to the bandwagon right now.
So Paradigm sounds very interesting. Tell us a bit about the study design, Aishwarya.
It is very exciting. So we've got 500 patients, and they'll be from various centres across the world. It's an international trial. And essentially what we'll be doing is, hopefully, we'll be looking at the radiologist reports, and we'll also have the AI-derived reports. We'll be combining the information from that and using that to then determine what happens next in terms of biopsying everyone and the results that come from that. And we'll be comparing the two and seeing how well AI can do relative to radiologists. What I would like to emphasize is we are not currently thinking about replacing AI. AI is a very quickly evolving space. What we do want to do is ensure we are making sure that patients have the best possible care. And if AI can help us get there, then so be it.
I had a patient recently who came for a second opinion, international patient. He'd already got his MR and put it into his own MRI, his own AI tool, and had a readout of it and was asking me to comment on it. And, that's the world we're living in now. So we do need to correctly evaluate this and have some validity. And the AI platform that you're using, Alex or Aishwarya, is this already validated or established, the particular one for the reads on this? Or is that part of the Paradigm thing, is to develop an AI tool? I mean, there's lots of them out there for MR.
Yeah, great question, Declan. So we're still finalising the specific algorithms we'll be using as part of the trial, but one thing we'd also like to look at is developing academic and local algorithms. But as you correctly mentioned, there are lots of AI algorithms on the market at the moment aimed at assisting radiologists in their clinical workflows. But as you've mentioned, there is a lack of prospective trials to support the data. A lot of this is based on retrospective data, even the very, very large PEAK-I paper published in Lancet Oncology last year. So it is needed to prospectively evaluate these algorithms, and it will help inform us on how best AI should be integrated into the clinical workflow.
Great. Paradigm. So is that open now and adding centres, or
soon to be opened?
Soon to be open. Okay, great.
Yeah.
Okay. Good luck. Sounds great. And these youngsters are going to be the driving back force in this again. Third-year medical student, fifth-year medical student. Not even a urology trainee yet.
Absolutely, I'd have it no other way.
Absolutely. Okay, what else? Anything else you want to highlight for us in Compass, in the Compass group?
It might be worth us talking a bit about RESECT, because I think it's an important project.
RESECT trial, we know this project.
Yeah, so this is a project led by BURST, and it looks at non-muscle invasive bladder cancer. We know from doing our TURBTs as trainees that these procedures might not necessarily lead to the greatest outcomes for patients. We know that when you spread a tumour around the whole bladder, I remember Tim O'Brien showing a field of dandelions and going everywhere in the field. It's a similar concept, and from that, as you train, you wonder, how can I check whether I'm doing this right and what my outcomes are like? And that's the concept from which RESECT was born. We knew non-muscle invasive bladder cancer has a lot to improve in terms of recurrence and progression rates. And we know from the work of mpMRI that the way you do your TURBT and your perioperative care makes a big difference. So RESECT was an international multi-centre cluster randomised trial comparing audit, feedback and education to standard of care in improving quality indicator achievement and recurrence rates in non-muscle invasive bladder cancer.
And it was like thousands of patients driven by trainees, I think, wasn't it?
Absolutely. Another trainee-led study. 200 centres, more than 16,000 patients recruited in a year and a half.
And will that be in a glossy magazine sometime soon as well?
It may well be in a glossy magazine. You've got to watch this space again on that one, Declan.
Excellent. Youngsters-driven research, trainees, medical students, and not just doing a little bit of fiddly retrospective research, doing prospective work. On that, can I ask you, we saw Jeremy Teo's trial last year from Hong Kong, randomised trial of en bloc versus standard TUR. Beautiful little randomised trial from Hong Kong, European Urology, showing a significant reduction in recurrences in the en bloc technique. Is that the sort of thing? Well, it's not been evaluated in this trial, but you could revalidate it in this type of trial, couldn't you?
Absolutely. We collected what type of biopsy, what type of TURBT was done, and we have data on whether it was en bloc or not. So we could look at that, and we plan to look at that in a multivariate logistic regression to compare whether or not en bloc made a difference in a real-world setting rather than a randomised trial. But of course, whether you use en bloc or whether you use a traditional technique, what matters is, as we found from the study, is being watched makes a difference to your outcomes. And the difference that we see in, for example, giving mitomycin C in chemotherapeutic drugs, for which millions of dollars have been spent, we find you can get that improvement from just being watched.
Yeah, I totally agree with you. So that's great. That's already fantastic. And what I'm impressed with is there's a culture within this group of getting younger people involved and inspiring them, and then creating high quality research, not just a few case series. And so I really wish you all the best with that. Is there anything else you want to highlight for us before we wrap it up?
I think that's all, guys. Anything else anyone wants to talk about or mention?
Or maybe, Aishwarya, you're going to grab the mic, Veeru. Because I might ask you about that. If there are younger people out there listening to a podcast, they don't have to be in London, our audience is all over the world. What messages would you have for younger people, medical students, younger trainees, about, why you're interested in using your free time to do this type of work?
Of course. Well, firstly, I'm going to say something which Alex beside me said, and that was that if you work hard, things will work out. You don't know which dots are going to connect up where, and you don't know where that will take you. So if anyone's sort of feeling that they don't quite know what they're doing, I would still encourage them to continue with their work ethic. But what I would also say is, if there are any of you out there who are very much involved in high quality research and that's something you're passionate about, please, please, please take some time to involve younger students, because we really appreciate the opportunity, and it's not really something we would otherwise get exposed to, as I mentioned earlier. So yeah, from both sides, work hard if you're the younger one, and if you're more senior, please involve us too.
I totally love it. Yeah, it's quite competitive in urology as well, Veeru. We want the brightest and best people to be doing urology in the future. That means we're competing with cardiology and general practice and all sorts. And the brightest and best medical students are going to make decisions relatively early on. So that's important, that you're setting up things that are going to attract the best and the brightest to want to do what I do.
You've got to get them early, Declan.
Very good. Great. Well, look, that's all we have time for on this episode of GUcast. Thanks very much to Veeru and the Compass team who've come along here today. And I hope you found it as inspiring as I have. Thank you.
See you later.